why a client's MND, ventilation and tracheostomy requires 24/7 critical care nurses. My name is Patrik Hutzel from intensivecareathome.com, where we provide intensive care at home services to long-term ventilated adults and children with tracheostomies. We also provide BiPAP and CPAP ventilation at home without tracheostomy. We provide care to tracheostomy adults and children without ventilation. We provide home TPN, home IV potassium, home IV magnesium, home IV antibiotic infusions, central line, PEEK line, Hickman's line, and port management at home, cough assist management at home, nasogastric tube, PEG tubes at home, as well as ventilation, weaning, and palliative care at home. Today, I want to talk about a recent NDIS assessment and also doctor's letter for a female MND client who has a ventilator and a tracheostomy. So the client situation highlights a critical issue we see far too often: the significant difference between what an NDIS participant needs for safe, quality care at home and what the evidence-based, peer-reviewed mechanical home ventilation guidelines actually recommend. And you can check out the mechanical home ventilation guidelines that are evidence-based on our website at intensivecareathome.com. I have linked to the mechanical home ventilation guidelines in the written version of this blog. So let's look at the dangers of inadequate care and why the mechanical home ventilation guidelines, which are evidence-based, are absolutely critical. The client has advanced MND, which is motor neuron disease, and is dependent on a tracheostomy and invasive ventilation 24/7. Client's care needs are extremely high, yet the client's current NDIS plan only funds about 2 hours of nursing care per week. This isn't just a funding issue, it's a patient safety crisis. The evidence-based mechanical home ventilation guidelines explicitly state that for patients requiring ventilation and tracheostomy daily, a second identical ventilator is required as a backup. Those guidelines also stress that all alterations to ventilator settings must be performed exclusively by critical care trained registered nurses. These guidelines also clearly suggest that exclusively critical care trained nurses need to be with a minimum of 2 years critical care nursing experience can be used for ventilation tracheostomy at home. These guidelines are not suggestions, they are evidence-based best practice. The risks of using untrained staff, like support workers or general registered nurses without ICU experience, are severe and life-threatening. The client's spouse has had to intervene on multiple occasions when support workers made life-threatening errors. These are the very situations the guidelines aim to prevent. Without 24/7 ventilator and tracheostomy competent CCRNs, the client is at high risk of, number one, mucus plugging or airway obstruction, ventilator failure, aspiration pneumonia, avoidable hospitalizations and ICU admissions, and high risk of death. So let's look at why a critical care registered nurse CCRN 24/7 is non-negotiable. 2 comprehensive clinical assessments have been done for this particular client, and the mechanical home ventilation guidelines both conclude that this client requires 24/7 care from CCRNs. The reasons are clear, non-ambiguous, and supported by the guidelines. Number one, advanced airway management. The guidelines mandate that CCRNs 24/7 are the only qualified professionals to make changes to ventilator settings, but also oversee any ventilation parameters. Furthermore, they are the only staff with the training to manage an airway emergency, such as a tracheostomy tube dislodgement, which can be fatal within minutes. Number 2, emergency preparedness. The guidelines specifically recommend emergency protocols and equipment. A CCRN is trained to not only use this equipment, but also to lead in a crisis, which is a skill set outside the scope of practice for general RNs, let alone disability support workers. Number 3, equipment expertise. The evidence-based mechanical home ventilation guidelines specify a need for specific equipment for our clients like this, including a medical-grade pulse oximeter and a portable end-tidal CO2 monitor for secondary safety alarms during sleep. A CCRN has the expertise and experience to use and troubleshoot this sophisticated equipment, ensuring all alarms are correctly managed. Number 4, patient safety and quality of life. The evidence-based mechanical home ventilation guidelines that you once again can read on our website and other peer-reviewed studies emphasize that for patients with neuromuscular diseases like MND, the goal is to improve both health and quality of life. This can only be achieved with consistent, high-level clinical care. Anything less not only puts the patient at risk, but also causes unnecessary stress for both the patient and their family. The NDIS, the National Disability Insurance Scheme, must follow best practice guidelines. Clinical consultation report and the NDIS support letter explicitly reference the need for the NDIS to fund supports that align with these best practices. These include, number 1, 24/7 critical care registered nurses, CCRNs for high intensity coverage. Number 2, specialized equipment including a second identical ventilator as a backup and a portable end-tidal CO2 monitor. Number 3, ongoing training and emergency drills as outlined in the evidence-based mechanical home ventilation guidelines to ensure all care staff are prepared. The client's goal is to remain at home, safe and comfortable. This is a goal that can only be achieved with funding for the right level of care as defined by the evidence-based mechanical home ventilation guidelines. For our clients like this MND client, a CCRN is not a luxury, it is a life-saving necessity. If you have a loved one with a tracheostomy or on a ventilator, please contact us at intensivecareathome.com for professional and compassionate assistance. We are here to help you navigate the system and get the care you or your loved one needs, wants, and deserves. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care. Tracheostomy care for clients without ventilation. Home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP. Home TPN, which is also known as IV nutrition. Home IV potassium and home IV magnesium infusions, IV fluids and IV antibiotics. We are providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEC tube management at home. The use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with the cabin crew instead of the pilot. Because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.